Hello everybody. I would like to welcome you, the followers of the Facebook page Slovak Crohn Club, and also the Association of Patient Organization from France. And definitely, I would like to welcome Bastien. He's from French organization. So welcome, Bastien.
Thank you very much, Veronika. Nice to see you again.
Thank you very much. So today we are going to talk about the current situation regarding IBD patients and COVID in Slovakia and France. We will see if there are any challenges, if there are any differences, any similarities, and hopefully we will bring you some very useful information just to make sure that, of course, some people, they don't speak English very properly. Then you will find out under this video the information in Slovak also regarding questions and answers what we are talking about. So first of all, when we take into consideration that nowadays the situation with COVID is not very, let's say, positive, because there are more than 2 million cases worldwide, then what about France? Tell me, what are the numbers regarding France, Bastien?
I think like in your country, the figures are evolving quite often. The last figures we have for France is that we have, let me check, we have 109,000 confirmed cases and more than 18,600 deaths. And just to tell you, we have 400 more cases in 24 hours and almost 800 more deaths in 24 hours too.
Okay, I see. Thank you very much. Yeah, then definitely in Slovakia the number is lower, but it of course comes from the lower number of the citizens in Slovakia. So in Slovakia until now we are having 1,089 cases and total deaths or total recovered, because we have to be also a little bit positive. And then in Slovakia, like it's 213 people who recovered, but also some people died, so it's 11. But when we are coming back to our associations, because we are volunteering there, can you please tell me some basic information about your association, about how many years do you exist, and so on?
Okay. So the French association is called Afa, and it exists since 1982. And I'm volunteering in this association since 2015. So 5 years now. And it's quite difficult to sum up all the activities of the association in a few words, because we are doing a lot of stuff. But
that's good.
The main areas we are dealing with is that we are bringing information and support to patients, thanks to different phone hotlines, local meetings, conferences, and also workshops. We also inform through our website, which we have updated it quite recently, so it's a all new website. We also have a magazine and of course social media, Facebook, Twitter, Instagram, every main social media. We have also developed a web platform called MICI Connect, which is a platform which patients and relatives can learn many things about IBD, about the disease itself, but also about nutrition, travel, how to manage stress and work and stuff like that. We have also a network of dietitians and a social worker, and to answer the questions of members of our association. We organize also stays for teenagers, for families, to give them the opportunity to meet each other and share experiences, questions, feelings. And it's very, very nice for the participants. It's the feedback we have. And we have also a big activity in the support to research, thanks to grants we are giving each year. Each year we are giving a global amount of 200,000 euros in grants for the research. And we are also doing health lobbying to bring the patient's voice in the health authorities.
Wow, it was really very nice answer, and I think you are doing really wide range of activities, and then congratulations, because it's really nice what you are doing. Maybe we can learn something from you. Yeah, and then just excuse me, probably I didn't catch just the number. How many IBD patients generally are in France?
In France, we have approximately 250,000 IBD people. And in the association, we have 8,500 members.
Mm-hmm. Okay, yeah. And that's definitely, again, different as far as I mentioned previously, that in Slovakia we have less citizens. So when we're talking about Slovak Crohn Club, we are working since 1993. And in Slovakia, generally, we are having approximately 15,000 IBD patients. Mm-hmm. So therefore, number of members in Slovak Crohn Club is a little bit lower. It's approximately 300, 400, it depends. But what we have in common is the range of activities as you do. Then, for example, I can mention educational seminars, conferences, also some stays for teenagers, or we are doing it for children and also mm-hmm. for seniors. So yeah, something we are having in common. And definitely what the next thing what we do as you is that we are also publishing the magazine, like each year it is. Maybe you are publishing it monthly or twice
not
a year?
Monthly. We have, it depends of the year, but we have between 3 and 4 magazines per year.
Okay, nice. Okay, yeah. So this is something also about our association. When we talk now about like nowadays, definitely we can't meet, we can't be in contact. So can you tell me what activities do you or are you doing nowadays when we are in the social distancing and we can't meet?
Just before answering your question, can you tell me about the organization of your association? I mean, do you have only volunteers? Do you have employees in the association, or many are you inside the association to run it?
Yeah, thank you very much for the question. So yeah, I'm the president of Slovak Crohn Club. I have been with the association approximately 4 years, but as the president, this is my 2nd year. And yes, we are just volunteering there because in Slovakia, maybe in some other countries, you can gain some money from the government to support financially your association, but in Slovakia, this is not the case now. So yeah, we are having approximately 10 people in board. So yeah, we are trying to focus on these activities together, and yeah, we are volunteering. And I hope I have answered your question.
Yeah, definitely. Yeah.
Okay. Yeah, and yeah, thank you. So now when we talk about this current situation, so do you come up with some maybe video conferences or anything for your members?
Yeah, as you said, with social distancing, we have to find new ways to do things for our members. And the main things we are doing is to bring them information about the current situation, about the COVID-19 in general, but also about IBD specific information. And we are organizing, we are used to organize local meetings between people, and to carry on doing this kind of stuff. We are organizing online meetings with tools like Zoom or Jitsi or Skype and stuff like that.
And excuse me, just for interrupting you. So do you organize this kind of video conferences so also together with the doctors or some social workers, or is it just like to come up with information from association to members?
These video conferences is, for now, only to meet people, to get in touch with other members, to replace local meetings physically, local meetings. But we are in touch with gastroenterologists. We have made 2 interviews of gastroenterologists to answer the main questions IBD patients have in mind about the current situation, about their disease, and about how to manage it, should they stop the medication or not, and stuff like that.
Yes.
So yeah, we use this kind of tool to also to stay in touch with medical care. And also for the association itself to work with each other with phone, mails, and online tools for video conference.
Yeah, this is the most important probably nowadays, to support each other and be in contact at least by phone, email, or social media. Also we have come up with these recommendations or measures from the doctors and gastroenterologist company, but until now we are just having some articles and in the text form, but we are also working on some videos, so hopefully we will do it as soon as possible. But I hope that also this kind of video, so Slovakia versus France, so regarding this situation, IBD patients and COVID, also this is kind of help and support for IBD patients, at least in our countries, so Slovakia and France. Good. I just wanted to come back to the general situation nowadays. Can you please tell me if your country is in lockdown, how long, or what are you doing at home, and so on?
Yes, we are in lockdown since March 17th. And the official information for now is that we will be in lockdown until May 11th.
Okay.
And at this date, we will start to remove the lockdown, but step by step. We don't know already how we will do it. Will it be regarding your age or your professional situation? We don't know. It's something to be to be a thing by the government. We have this milestone, May 11th, and it should be the beginning of the removing lockdown.
Okay, and so when you can you please tell us what is the situation in the hospitals? What is the situation in ambulances? Do doctors have enough, equipment, gloves, respirators, masks, ventilators? What is the situation like that?
It's a tough situation because hospitals don't have enough equipments. The major lack of equipment is about masks and respirators too. We have also a lack of overalls, like to protect your body. It's because France don't have anymore stock of masks, so we have to order them. And as every country in the world are ordering medical equipment, we have to deal with that. And we have started receiving some equipment from China. And but yeah, for now we don't have enough equipment, and we have also a lack of beds in intensive care.
Okay.
So yeah, it's the main issue is to get to spread the number of people who have to go in intensive care in order to have enough beds for everybody, and also to buy enough equipment to protect medical care workers.
Okay, thank you.
What about the Slovak situation?
Yeah, definitely. I just wanted to say that it's really, really similar. Also, we have a shortage of many protective materials, or protective masks, respirators, even the overalls. And yeah, so hopefully it will be solved as soon as possible, and that we could cover all needs. And what about when we're talking about masks and gloves for citizens, for people? What is the situation with that?
The official message from the government is that general population don't need masks, except for people working in, people who are in contact with the population, for example, policemen or people working in grocery stores. For these people, they have to wear a mask, but at the beginning, we didn't have enough masks, because even for medical care, there were not enough equipments. So the emergency was to send these equipments to medical care, and after workers in contact with the general population. But now the government is changing its message, and now they are saying that when we will stop the lockdown, they will give access to the general population mask. But we don't know yet if it will be equipment, if these equipments will be distributed to population, or if we will have to buy them. We don't know yet.
Okay, so did I understand properly that when you go out, you don't have to wear a mask? So this is not the rule.
Yeah. You have some people who are lucky enough to get a mask. So you can see many people wearing a mask, but the official message is you don't need it for now.
Okay, this is really interesting, because in Slovakia, it is a restriction to go out only with the mask. And yeah, because in Slovakia nowadays, every mother, every woman, every girl who is at home is sewing even the masks from the fabric. So I think when I now think about it, that probably we have a little bit more masks, because we are just making them at home and sewing. And sometimes, what I'm really proud of, that even really the public people from home, they are trying to deliver these homemade masks even to policemen, to doctors, and this is what I have to be proud of.
Yeah, we have the same thing in France. We have people sewing masks, homemade masks, and we have many tutorials on internet, on YouTube, to make your own mask. And we have also companies, French companies, who have started to produce masks. And we have also many people who are kind of volunteering to make some food, to bring it to hospital for medical care. Because they don't have time to cook and stuff like that. So the population is like, if there is something I can do, maybe it's not a big stuff, but if I can cook for maybe 10 people and bring it to the hospital, you know, it's a small thing, but it's the addition of these small things, which can be a lot.
That's nice, yeah. And just the last thing about kind of general information about situation with COVID in France. Do you think that your government provide real numbers and information about the situation in your country, but as well as worldwide? And is the communication via TV, radio, social media, or how does it work?
I think in France we have a good information about the number of cases and dead people and stuff like that. At the beginning, we had only the death from hospital, and since maybe 1 week, we have also the death from retirement homes, because we have many people dying because of COVID-19 in this kind of place. And for the situation worldwide, I think we have also good information. The only thing, I mean, I'm surprised that we don't hear many things about Africa for now. And I mean, we have many information about what the situation in the nearest countries in Europe. I mean, Spain, Portugal, Italy, Belgium, UK, also in the US. We have also information in Asia, China, South Korea, Taiwan, but we don't know very many information about Africa, and I think it would be a big issue in this continent. But otherwise, yeah, we have. I think we have all the information. I mean, the main information.
Okay. Yeah, I'm glad then that you can, rely on this information, because, probably not each country is giving all information, or you remember this case with China. I am not a specialist, so I'm not going to talk about like if it is true or not, but we heard that, Chinese government, they didn't give us the real numbers. But this is some other story, so we don't have to talk about it. But very good point, Bastien, about Africa. Yes, I agree. And I also don't know why we don't hear anything about them, or just we lack the information. And yeah, as far as the social system, health system, there is probably not on high level. I don't want to know about the, circumstances and consequences of this COVID situation. So just fingers crossed for them. Good. When we come back to us, IBD patients. Okay, then probably this is the same in France as in Slovakia, that we are receiving information from the government, but I hope that it is also from the Gastroenterological Association and doctors themselves. So, and you also mentioned that you provide this information via video conferences. Again, are you satisfied with the information? Do you rely on your gastroenterologist? Are you in the regular contact with them? Do they provide enough information for you?
Yeah, I mean, IBD patients are, I mean, not every IBD patient is in direct contact with their gastroenterologist. But as I said earlier, we interviewed to gastroenterologists to ask them all the top questions people are asking. And gastroenterologists gave us also, I mean, in the association, the good practices, about medication, about are you more a risk person to catch COVID-19 and stuff like that. So yeah, I think we have enough information coming from gastroenterologists, and we don't have information coming directly. I mean, at the IBD patient level, we don't have direct information coming from gastroenterologist associations. But thanks to the French IBD Association, we catch up this information to deliver it to our members.
Very good, super. Okay, and yeah, again, this is very same here also in Slovakia. We are all in contact with doctors, with the Slovak Gastroenterological Association, but in Slovakia, we are also in contact with some other patient organizations. We try to share information, to share experience and support each other. So is it also this case in France? Do you exchange this information with other patient organizations?
Yeah, we are in contact with other associations. We are part of an association which gathered different chronic illness, chronic disease. And so the association has a meeting every Thursday, to share information and to share experiences and stuff like that. So yeah, we are updated with other associations on a weekly level, and maybe even on a daily level if there's something new. Yeah.
And this is also the proof that we exchange information even among countries like this now.
Yeah.
So that's really great. So when we finally come to really the IBD patient, what do you think from your point of view? Yeah, also the IBD patient. What does IBD patient need the most nowadays? What do you think?
Thank you for this question, because we have made a survey less than 2 weeks ago, and we have around 2,000 people answering this survey. We send it only to our members, so it's 2,000 IBD patients, and I've picked some figures about this this survey. The biggest concern for IBD patients is to have reliable information about COVID-19 and about IBD perspective, IBD patient perspective. We have 57% of people seeking for reliable information. And we have also 37% people who wish to have access to relaxation sessions, to manage stress and stuff like that. And also 27% who wish to have access to physical activity sessions. And we have also a third of people who want to have information about their rights and how to prepare their return to work after the lockdown.
That's really interesting survey. Thank you very much for sharing, and definitely we can learn again from you, and this is a good idea to also ask our patients or members. What I must say.
And do you have in Slovak Association, do you have information about what is the main needs of your IBD patients?
Yeah, as I said, we don't have any information from the survey, but I mean, like in the formal way, but definitely we have asked and we are still asking, what do you need, how do you cope with this situation? And this is also same as in your country, that yes, people really need the relevant information and updated information. On the other hand, I must say that, you know, there is really a lot of information and we are somehow fed up with that, because you really want to just, you know, cope with that and try to go on and to think about your physical health, your mental health, and how to cope with that. So definitely, as you said, that there is a need to have access to relaxation sessions or physical activities. Definitely, this is the same with us. What is also interesting is that yeah, a lot of IBD patients, they have in Slovakia problems like, okay, I am working, but I can't stay at home because of IBD, because this is probably not according to legislative or the law. So they have to go to work, and maybe this is really the issue we need to talk about with the what's a government or association or institution that you know, supports the rights of patients, because it's really like sad when you are the chronic patient, you are IBD patient, and you know, could be infected, and you just really need to go to work and you can't stay at home. So this is probably the issue we have to solve in Slovakia. Yeah. And what about the cure? What about the medicine, biological cure? Do you have? Is there any shortage, or do you have anything that you miss, or should it be all right?
For what I know, I don't think we have a shortage for pills or treatments you can have at the pharmacy. And it's also the same for biological treatment you have at hospital. We have also asked in the survey about that, and for biological treatments, and IBD patients say to us that 79% of their treatments at hospital were maintained. The other ones, 20% were just cancelled or rescheduled later.
Okay. And so when the patient is on biological treatment, does he or she have to go directly to the IBD center or to the hospital, or is it possible somehow to, you know, provide this treatment directly to his or her home, or how does it work in France?
For if you need an infusion for your biological treatment, you have to go to the hospital. You can do it at home, and so I don't think this has changed even with the current situation. But what you can do in some cases, you can have access to a taxi to bring you to the hospital and bring you back home, so that you don't have to take public transport and stuff like that. So yeah.
So who does pay for the taxi then?
The healthcare.
Okay.
Yeah.
Okay, that's great.
Yeah.
Thank you very much for this very important information for Slovak patients. Okay, and was it any change, any break at the beginning of? So we can say about, or we can talk about 17th of March, because you mentioned this date as the beginning of your lockdown in France. So was it somehow that IBD centers or gastroenterological ambulances, they closed for a short period of time and then reopened? Because this is why I'm asking, because in Slovakia it happened, unfortunately, that some IBD centers for biological treatment, even ambulances, they closed. Honestly, I don't know why, or there are some, definitely there are some reasons. Probably they had to, you know, disinfect everything and so on. But it was a little bit chaotic for IBD patients because they didn't know what to do. The phone was only ringing, nobody answered. And also you had the date for biological treatment, and you just couldn't go there because they were closed. Fortunately, the situation now is much more better. We are working again, but yeah, it was a little bit stressy for Slovak patients.
Okay. It's interesting. I'm surprised that ambulances and medical centers can close in this kind of situation. We don't have that in France. I mean, it's almost the contrary. For example, we have retired doctors who offer to go back to work to help hospitals to deal with all the sick people going to hospital. But yeah, I don't have heard about ambulances or hospitals or medical centers closing during I mean, since the beginning of the lockdown. Yeah.
Good. Let's now focus on probably the last two questions, but maybe the most important for IBD patients. And it is, what are IBD patients doing nowadays in France at home? What are they doing? Are they, generally cooking or sewing, or what are they doing?
I think they are doing, the same things as everybody else, like cooking, sleeping, watching Netflix, sewing for the ones who know how to sew, playing board games, and I don't know, reading books, doing physical activity. I think I don't think IBD people are doing things different than other people. I mean, everyone has to fill the time at home. So yeah, every idea is good to take to not be bored.
Yeah, definitely. I hope that everybody is, turning up and cleaning the stuff, because you never had time for that. So now you can't excuse yourself. You just need to do it. But yeah. And did you have any problem? Because now it just reminds me that during Easter time it was really nice and sunny weather, and we really wanted to go outside and maybe to the nature, or maybe to cottages or weekend houses we have. But actually it was not possible in Slovakia if your weekend house was out of your district where you live. So, we were a little bit, again, stressed because we had to stay at home. Was it somehow like that during Easter time? Because it was like public holiday in Slovakia, so I'm not sure how was it in France.
We have also public holidays for Easter, because France is a Catholic tradition country, even if the church is separated from the government, but there were no differences for Easter's than to other time in lockdown. We were not allowed to go out. I mean, except for going to grocery stores, to go to work if you have to go working, or if you need to go to the pharmacy, or if you have a medical appointment and stuff like that. But otherwise, just for Easter, there were no exceptions.
And does it mean that you are not allowed to go out? Does it mean that if they meet you and you don't, prove somehow like, okay, I go to work, or okay, I go to a supermarket, or okay, I just go somewhere, I don't know, to the pharmacy or to the doctor. So can you get a fine, or how does it work?
When you want to go outside, you have to fill a form to declare why you are going out. if it's for groceries, if it's for going to work or going to medical stuff. Yeah, you have to do it every time. Wow. And you have to do it just before you are going outside, because you have to write down the day and the hour. Yeah, and yeah, we have to do it every time.
Okay, but do you fill in this form online or just on the piece of paper, or?
At the beginning, it was only with a piece of paper. You could print it from the government website, okay. Or you can write it down from a blank page. But since maybe 2 weeks, you can do it online. You just fill some blanks, and it generates the form directly on your smartphone and stuff like that.
Oh, wow, I have to say I'm a little bit surprised, because in Slovakia we actually can't imagine to be, you know, under the control this way. But I'm not saying which is good or bad. This is your restriction, so definitely you need to follow it. But really, I can't imagine. So maybe this will be a very good, you know, opinion and very good idea for Slovak people who sometimes, you know, they don't agree with the restrictions, and they go out with children, and of course they say, okay, I'm wearing the mask, so what should, you know, what could happen? So yeah, thank you very much for sharing this important information, definitely. And when talking about the IBD patient regarding nowadays, what do you think, or do you have any information, any data? What is the biggest fear of IBD patient or of your member of your organization?
Yeah, it's also something we learned from the survey we have sent to our members. 70% of answers are telling that they fear to get sick with COVID-19. And around 70% of people are afraid to develop a severe form of the disease. And we have, I mean, the second most important fear is to go to hospital. Because of that, it's 37% of answers. And we have also a third of patients who are telling they are afraid to get in relapse with their IBD. Also, not being able to reach their gastroenterologist if they have a problem with their IBD.
I see. Okay. Yeah. Again, it is really similar also to our members or IBD patients. Yes, we have also a fear like what can happen if I will get you know, COVID, and what will, you know, be the case, and so on. But you know, IBD patients in Slovakia, some of them who work, they also have a fear like, okay, will it be able, or will I be able to continue to work, or will my company need to close, so I will lose my job? No, because in Slovakia, as probably everywhere, a lot of companies, a lot of factories, they have closed down, and some like small companies, they even had to fire a lot of employees. So this is also the fear, probably not only of IBD patients, but generally people in Slovakia.
Yeah, I see.
So, but to, you know, finish this very productive and very nice discussion, we should really be very positive about like generally about IBD patients, because I think we are, you know, taking all restrictions and measures very closely, and we really try our best to follow it, and you know, to protect our health, because it's only about our health, about our families, and we just really want to come to the end of this situation with COVID and to continue with our very beautiful lives that we had, and hopefully we will again come to that, and maybe we will be even, you know, wiser. We will be more flexible with some things we didn't you know, understand or we didn't use. So thank you very much once again, Bastien. It was very nice talking to you.
Yeah, definitely. Thank you for the invitation. It was very nice to have this talk. Yeah. Yeah,
you are welcome. So to everybody, to all patients, even from Slovakia or France or worldwide, we fingers crossed for us. Thank you very much for watching. And please, if you don't speak English, then you can see under this post the translated questions and answers of this discussion. So thank you very much.
Thank you.